Okay, so we are here with Darcie Green from Latinas Contra Cancer. And we, of course, don't know that much about Latina Contra Cancer, purposefully, so that we could ask you about it. But tell us about Latina Contra Cancer and how you became Darcie Green.
Oh, gosh. Well, Latinas Contra Cancer, we've been around for almost 22 years, founded by visionary, trailblazing Latina leader Isabel Duran. After her own cancer journey and seeing what Latinos were facing and trying to access cancer. And so our organization has evolved so much over the 22 years. We are health educators, we're patient organizers, we are patient navigators, we are advocates, we're researchers. We do a whole lot across the cancer continuum. We serve people who have been diagnosed with cancer, people who've survived cancer, but also people who have never had cancer and we hope never have cancer. So it's a wonderful organization that allows us to live at the intersection of health justice and organizing work, but also service providing.
Ever since you've been with Latina Contra Cancer, you've been out there on the front lines, you know, with all of our other cultural leaders. And so I'm wondering where your drive came from. Where did that passion come from?
Yeah. So I'm a Latina from Eastside San Jose, third generation Eastside San Jose resident. And I say that with so much pride and so much love. I love us. I love East San Jose so much. And as a Latina growing up in Eastside San Jose, it was also, health inequity was just a drumbeat all around. I saw health injustice in my own household. I saw health injustice in the places where I went to school, where my family would go to shop or to play in parks.
And that's really cool that you say health injustice, because a lot of people just see the justice, but not a lot of people look at it from the health perspective.
Yeah, health is, I can make anything about health, but there are health intersects so many different places. Just watching firsthand the way that even my own family would try to negotiate and navigate certain expenses over healthcare, or trying to think through how do you access a healthcare system, even when you have insurance, that could be so difficult to access.
Oh, yeah.
And if you pair that, just looking back and witnessing so much health injustice of every different kind across all the social determinants, and also that I was an organizer of about 13 to 22 with PACT. And so
yeah, I heard the stories about you showing up to events and being like,
yeah, what's up? So when you pair a Latina from Eastside San Jose who sees so much injustice around, but then that same Latina is then given the language and tools of organizing at such an early age. And I remember an organizer from PACT meeting with me to have a one-on-one and asking me questions like, if you could change anything about the world, what would you want to change if you could?
Big ass question.
Big questions, and I really and saying you have the power. You have power as a person, as a young person, as a teenager. When you are collectively with others, you all have power, and I believed it. And we did some incredible things, and that feeling of organizing with other people, identifying an injustice, identifying a solution from people who are impacted, organizing with others to make that thing happen, even if it takes years. There was one organizing campaign I was on. I was 14 when we started and 22 when we accomplished it. And learning the longevity of the work, right? Your place in
not giving up.
It just became something very addicting to me.
And not a lot of people end up translating that into later work. A lot of people get into organizing and then they enter the private sector, or they get they do whatever. But you kind of stayed in the community.
Yeah, I did spend some time at Kaiser Permanente, which was a fantastic role for me. It was government relations, community relations, and
Kaiser's pretty cool.
Yeah, I learned a lot about healthcare. I went during the time when the Affordable Care Act was being debated.
That must have been foundational.
Well, yeah, when I was working in the legislature, I was staffing many different policy issues, and you don't really get to dive deep into any when you're in the field office. So when I was at Kaiser, I got to just know a whole lot about health insurance and health care and how hospitals work. So when I came here to Latinas Contra Cancer almost 8 years ago, I was able to bring that background of organizing and public policy work and politics.
I want to see the look on Kaiser's face when you took all that experience and went through Latina Contra Cancer.
Oh no, they were supportive.
That's great.
Yeah, really helpful. The folks at Kaiser have been really, really supportive of our work, and I learned a lot about justice there too.
Then they had a smile on their faces.
Yeah, they've been really supportive. Some good folks over there. One of the reasons I wanted to come to the nonprofit sector, this is my first job ever in the nonprofit sector actually. One, my grandmother passed away of breast cancer, and she was in the first support group ever held by this organization 27 years ago. So I did feel like it was a little bit of honoring,
your grandmother.
But
rest in peace to her.
yes, thank you. In breast cancer awareness month, she passed away breast cancer.
Mm.
But I remember as a younger person, was very close with my grandmother, who was an orchard worker and a cannery worker, that this organization provided so much dignity. And so when I came here to LCC, the word that just kept coming up for me was dignity. How do I make sure that our organization is fighting for the dignity of all people? The healthcare system in so many places fails people. In so many places it doesn't treat people with dignity. And in many, many places it's just not set up to do that. It's not that it's, broken. It's
But then you have power in numbers, and then your organization comes in.
Yeah, I was always curious, particularly when I was at Kaiser, I used to have these thoughts around what would happen if a bunch of patients decided that they were going to just not leave our lobby until one of them got the care that they needed. I was always really fascinated because I'm an organizer, right? It doesn't go away, it stays there.
Social experiment.
Right.
Yeah.
I was always just wondering, what would happen if a bunch of patients just and did it for maybe just someone's care? And that would always just really fascinate me to think about. So when I came here, it seemed like the right place to think about patient organizing and how do we build a patient organizing movement where patients
A place where thinking things like that isn't so foreign.
Right. Well, I mean, I think there should be organized patients wherever healthcare is delivered. Wherever healthcare is delivered, patients should have power. They should be organized. They should be able to make demands. They should be able to bring consequences, right, for not doing right by patients. And we have to.
That's why we have the medical boards.
Yeah, that's one way. Yeah, one way.
One way. You know more about it.
One way. But sometimes it doesn't even necessarily need to rise to the occasion of malpractice. Sometimes it can just be
having conversations.
Yeah, having conversations, or it can be we looking at resource distribution within hospital systems, or where hospitals are built, or how they're built. And what type of
See, I went straight to malpractice, and you went to there's all these other avenues.
No, I mean that's one space, right? Yeah. That's one space for sure, and definitely there are organized patients there, and there are trial attorneys and different folks who work on that. But healthcare should belong to the people. In all aspects of it, not just when something's going wrong or when someone has been wronged or something rises to the level of medical malpractice, but hospitals can be co-governed. They can be deeply in community. They can be, and regardless of who owns them or what payer system they have. I envision a day or dream of a day where we think about our hospitals and our clinics the same way we think about libraries and schools or parks, right? That we have some public ownership over them. So I know there are many clinic systems that are thinking that way too.
Definitely.
But, our healthcare system, really
and it's because of folks like you.
Leading the charge.
Yeah. We have amazing, brilliant people who work here at this organization, who work very, very hard and who believe in health justice too. So it's a honor to be able to come here to this organization and to work alongside all these folks.
Everything with Latinas Contra Cancer, really how they've let that attention strive into bringing more attention to what's going on with our healthcare system, not even just locally, I think even nationally here in the country is very important too as well.
Yeah, we've been able to have many occasions at a national level to be able to bring voice to the issue of racism in healthcare. It happens.
Racism is everywhere.
It happens. To be able to bring voice to the work of justice, and we often use the word health disparity, but I like to use the word injustice because I use the word disparity too. But I like to work.
Disparity is kind of
yeah. Sometimes it masks what's really happening, and I went through this fellowship when I first started.
Because when you think of someone in despair, somebody who's helpless can't.
Yeah, that's a really good point because health disparity isn't just a natural occurrence. There's part of the political education we do here around healthcare is to be really clear about who or what is causing the problem. It's not enough just to say, okay, well, you don't have the care that you need.
There's a
disparity. We're going to have the care that you need. It's a disparity, and who knows how it happened. We don't know how. Nobody knows how it happened. But in reality, there's always a reason that it happened. And what I learned over time is that it's always because of public policy that baked that kind of racism or injustice or bias or discrimination in, or an absence of public policy protecting vulnerable people.
I was about to say, it's very much systemic, and it's it very much hurts the people that are in those hospitals at the bottom.
Yeah, I mean, individual behavior matters. Absolutely, we want people to maintain healthy lifestyles and to think about their prevention and detection. But when we place too much focus on individual behavior, then we can get into this space of shaming people
Yeah,
Or-
because like you said, your regular doctor's appointments, your regular checkup, not everybody has the privilege to take off work to go.
Right. Or
take an
let's say you
appointment or-
live in a place that is causing a chronic condition because of the environment.
Yeah.
Or let's say you live in a place that there aren't safe spaces to
External
exercise,
factors.
or there's all of these things that you could do everything right. Like my grandmother, she maintained a healthy lifestyle. She didn't really drink too much. She didn't smoke. She maintained her weight. She did all these things.
You
She
could
still got
maintain a
breast
healthy
cancer.
lifestyle in a glass house.
Well,
where you're
yeah, and
still in
she, and many of her comadres had cancer, and may have been the impacts of working in an orchard and a cannery, right? So these are, she did all the things, quote unquote, right. Although I have issue with even what we say is, right or wrong, or these are not binary things.
As in, like the things that wouldn't traditionally cause such a disease, but then it still happens.
And still, these things happen because of other factors. The better thing is to think of it collectively, like what are we doing to make it more possible for people to achieve health, instead of individually blaming people, especially when we know that politic and public policy plays such a big role in healthcare. Something that I think is important for people to remember is all healthcare is political. Also, when people say like, "Oh, healthcare is not political," it's like,
No,
I'm not even talking necessarily like partisanship political, but it's all healthcare is political because it's about the distribution of resources, it's about power, it's about who gets what. There are so many moments within our healthcare system, and frankly, in many systems,
Of course.
where there are judgment calls on deserving that happen. One of the biggest indicators that we are in a system that places more value on some people than others is how much healthcare is tied to employment. And if you lose your job, you lose your healthcare, which is a signal that if I am not producing for an economy, if I'm not producing for capitalism, then I don't deserve healthcare, right? All of these signs, indicators, within our systems that tell us that we are only worthy of healthcare if we can purchase it, if we are producing something. And now, with the potential for means testing for things and work requirements, just more embedded shaming and guilt and telling us that some people are more worthy of healthcare. And the way that we view it here is we don't care what your lifestyle is, what you do, if you smoke, you're not, whatever. Everyone deserves healthcare. Everybody. There's just like bottom line,
straight up,
everybody deserves healthcare. We have not achieved a law of the land in this country where healthcare is indeed a human right. We just haven't. It's not embedded in anything. It's not. We are not there yet, but that should be the goal.
Definitely.
Yes. What do you think of like all these like other countries that do have a universal single payer healthcare system, like Denmark, Sweden, and the Netherlands, and why the U.S. is so like stingent on not receiving that type of system?
We actually have a 10-week cohort called Defensores, a co-learning space, and we talk about this a lot actually. The very first session is on the origins of healthcare in the U.S. because it's important to understand, in order to answer that question, it's important to understand how our healthcare system was created and the racism that was built into it from the very beginning. Because when you come forward to modern day, it's not just capitalism, but it's also racial capitalism. You look through history about the times when national healthcare plans were pushed, and there were different interest groups that, for different reasons, lobbied against that. And so we fundamentally don't believe that all people deserve some things. We see that in many systems, like we mentioned earlier, systems of social welfare, systems of we as a country have this bootstrap narrative that really only serves capitalism, and that bootstrap narrative of individualism, and if you just work hard enough, you're going to achieve the American dream, is still very, very, very present here. Underneath that is racism, right? And discrimination and patriarchy. You don't become a billionaire without exploiting people. Like, exploitation is a requirement on the way to, like, the pathway to becoming a billionaire. So if exploitation of workers and people is on the pathway, right, to becoming a billionaire, caring about the social welfare of the people that you're exploiting probably is at the top of your list. There are a lot of things to unpack, and at the end of the day, there's also just political will. Or there's also just political will.
Agreed.
The beginning of your question around other countries is a really good one, because you don't have to agree with everything a country does to appreciate aspects of different pieces of its systems. Cuba has a really interesting medical school, and the way that doctors are arranged there. They also have a really interesting clinic system that's deeply rooted in community. I know Brazil has a really interesting form of promotoras. New Zealand has some really interesting community-based work happening.
All these countries that at least America usually sees as not on par with us are still somehow figuring out how to get a better healthcare system, or at least a system that works for them.
The reality is, here in this country, even wealthy people are worse off than their counterparts in other similar countries.
Yeah.
Right? Even wealthy people, from a health perspective, from a quality of life, longevity, how long you will live perspective, are worse off than their counterparts in other comparable countries.
Yeah.
That's very eye-opening.
Yeah, I mean, you don't do things well around health here. I mean, we don't. It's very stressful. We don't have a lot of leave. People don't take a lot of vacation. We don't give people time with their kids when they have children. We don't give people the things that most countries do in order to secure for people a quality of life that allows people to have joy and leisure. And in this country, we also, for some reason, are committed to the failed experiment of policing in prisons. Right?
Yeah.
And so, and I believe this is tied. I think that wanting universal health care for this country and also wanting to see the abolition of the harm of the PIC are two sides of the same coin. We insist on treating healthcare problems with carceral systems. So the closing down of mental health facilities, the number of people who are incarcerated that have health conditions that need care, not incarceration, the violence that happens in these systems, the people who are experiencing mental health crisis and are treated as criminals. These are the prevalence and the size of our prison industrial complex in the U.S. is also one of the factors in why we cannot achieve national health care. As long as we're continuing to push public funding into these systems, we will always be underfunding healthcare.
Yeah.
Our public healthcare system is worth fighting for. It is. One, it's accountable to the community. Even if there are things that you wish it were doing better, there's a pathway to make that better because it's accountable to the community. And it has many world-class aspects in this healthcare center. So and it is worth fighting for. So at Latinas Contra Cancer, 98% of the folks we serve are on Medi-Cal, or receiving Medi-Cal. Most people we're serving, not exclusively, but are getting their care at the county. So when we think about what's at stake, just from being a good partner and coalition member, obviously this is a fight we're going to jump into. Yeah. But it so directly impacts the people that we serve, the people who work here as well, and the communities that we live in, that I don't even want to think about what might happen if we don't come together as a community to pass this measure. This is part of resisting, right? I mean, this is part of saying no, we are not going to allow the federal government to come and kill our folks, literally. We're not going to allow them come in and harm our communities. We're going to protect our block, right? And so we have to pull our money together to do that. And is it fair? No. No. Of course it's not fair.
Absolutely.
They make me love to tax ourselves? No. Like, in the midst of everything else going on? No, of course not. But we have to protect each other. Like, we have to keep each other safe. We can't be a community that just turns our back on our healthcare system or turns our back on vulnerable people.
Thank you so much for sitting down with us. We really appreciate it.
Thank you for the time you're taking to meet with folks.
Of course. Thank you so much.
Come back anytime.
Yes.
Come back I love that. That's like a TV show. That was great. Thank you, Darcie.
What's up, man?